Dr. Hoa Nguyen. Thank you, Doc, for joining us. Good morning.
Good morning, Sabrina. Good morning, Chris.
Good morning.
So we haven't chatted in a while. I know how many PAG meetings were there this week, and if you could, we'll just give you the floor, and you could kind of unpack what the discussion was about.
Yeah, we just have Tuesday and Thursday PAC meeting, and basically to give you an update, and we just basically, what the new guidelines for traveling is, and we just have a lot of debate on what defines the hotspots, and that way, as we go forward, like I say, every country changes the statistic every day. So once a week, we will probably monitor that and change where the hotspot will be. So it can define, who's the passenger coming in, what plane coming in. So that way we can decide, do we need to do the hotel quarantine or we do the home quarantine. So that's the major topic. So we've come up with a flow sheet that use different criteria rather than just one, and basically, but based on some different criteria from different tables, from that data, we will define which country have a hotspot. So that I think they try to finalize and put that on a public website so people know how we define which country the hotspot. This whole thing is basically try to protect Guam, as we are doing very well at this point, and we just try to make sure that we have some control on what's coming in, so that way we can minimize the risk of our island at this point.
Mm-hmm. So this hotspot, it's going to be placed on a website so people can check it daily? Because it sounds like it might be changing.
It's going to be weekly. We're going to monitor weekly. And people, if they want to find out how we define hotspot, they can see the flow sheet. But like I said, we can't change daily. It's very hard to do that. So, once weekly should be adequate. To change the hotspot or not. So, it's based on a lot, just the new case, the death rate, the hospitalization, all kind of data we have to use in order to define what the hotspots. We can't say which country, but we can decide, hey, because of this, we decided you are the hotspot.
Mm-hmm.
So what are the hotspots right now, Doc? Do you know?
Right now, I think the only one we have is the Philippines, but that's the only one that currently come in. I know they canceled the flight on the 13th, the first flight coming in.
Mm-hmm.
But I think the 15th and the other 3 flights for the rest of this month still on. So I know it's the flight sometime 200 people, 190, 180. So it's quite a few people coming from the Philippines still.
Mm-hmm. All right. So again, if you're coming from anywhere with this that's been designated as a hotspot, is mandatory a government of Guam quarantine facility.
Yes, it's going to be mandatory.
With or without a test, right?
No, without test. We don't require tests anymore. But we are talking to see if we can, after a certain amount of days, that we can test people out the hotel so they can return home as soon as possible. So we try to define a period where we catch at least 9% of people if they're going to turn positive or not. So we're going to test everybody in the hotel, asymptomatic or not, asymptomatic. We're going to test them and see if we can send them home a bit earlier. Right now, I think I can quote under 9 to 10 days, we probably will test them.
Mm-hmm.
So that way, we can send people home a bit earlier, and also, we probably have a lot of more information to see what the prevalence of the COVID-19 coming in from the country.
Mm-hmm. So you guys met last night. Was any discussions about PCOR 3?
I think that some PCOR 3 is supposed to come out like 21 days or so after PCOR 2, if everything's all the 4 guidelines there, the rate of infection, the ability of testing, the hospitalization, and those things. I think we are on track to go to PCOR 3. So so far the rates have become very low, just 0-1. So I don't think that we are having a showstopper right there. And we also, talk about daycare. We have a small task force. Before finalized by next Tuesday, we really want daycare to be open. People go back to work. We have the daycare association development. They come by and give the briefing with their guideline, what they put through for the daycare to ensure the safety in the center. And we all applaud what they have present to us. And again, we just have to twist some number, some guidelines, present that to public health with Linda and her folks, and then if everything is a goal, we hope to open daycare soon, so that way people can return to work.
Doc, is there a disconnect between the PAG and public health? Because I know that you guys had these discussions, and we had folks from the daycare and folks from the recovery panel on the show, and they seem to think that with the guidelines and the measures that the daycares came up with, that they would be able to pull off opening the daycares while mitigating all the risk and the social distancing and doing all that stuff. But when we had asked Linda in the press conference, her answer was pretty short about it, and it was basically like they're going to be the last to open.
Our first meeting with them is let's see, what's the Thursday on Thursday of last week. That's our first meeting with them, and public health is there, so we're going to be in the same page,
Okay.
guys. So move forward. I like timeline, so I asked them, by next Tuesday, I really like to close this thing so we can present to public health. So you should be daycare open the next, if it's approved by public health and the governor bless on it, so we can be open that very, very soon.
Wow.
So they are there in the public health, and CDC are there on the meeting. So we all want to sit in the same table as of last week. So you should have people should say the same thing.
Mm-hmm.
Nice.
What about adult daycare for Manumco? I know that we've talked to mayors about that. They're getting kind of, they want to get back together and socialize, play bingo, all of that.
Yeah, it's the social distancing is the one that you have to really worry about, the mask. And Manumco is probably the one of the highest risk of them all.
Mm-hmm.
So I think until we have a little bit more stability, make sure that people start to go back somewhat to new norm, go to restaurant, go eat, all that kind of stuff, that we still see the numbers low, that I think we can talk about that, because that's a very special population that
Right.
will affect them
Right.
most, so we try to protect them. So I know they want to get together, but we really have to be very careful in that population.
Doc, what's your take on the opening of the bars? What's interesting, I think, is that we open restaurants for dine-in to 50% capacity, but some of these restaurants are really just glorified bars that happen to serve food. So, we had asked, who was that we asked about the bars?
I'm not sure.
It was on, anyway. So we had asked somebody, and the response was like, oh, I don't know about all that. So I'm just curious, what are the, I think it was Dr. Manglotnia. So, Doc, what are the issues with the opening of bars if we're allowing all these other businesses to reopen and putting the onus on them to social distance and to, make their businesses compliant with all the mitigation efforts and all that stuff? So what is the big issue with the bars?
Right now, restaurant we open at 50%, and we still require masks to use, and except when you sit at your table, you take your mask off and you eat, but you go to the bathroom, something that you still put your mask on when you walk around. And the table are you have to have a certain number of people on the table. I'm not sure it's 6 or 10 or something like that. But the bar is kind of, I know a lot of restaurants have bar there, but if they want to open for restaurant, the bar cannot be open, because it's kind of very hard to keep the mask on. And, guys, mask and social distance as the number one thing right now in trying to prevent the spread of the virus, beside hand washing. And, based on the history, like even in Korea, when they open the bar, there's a spike of COVID-19 coming up. So when it's hard to be drinking and socialize and not put the mask on, so it's very hard. That I agree will be probably the last one. With alcohol mixed in there, is people will not exercise their best judgment. So I think it's an enjoyment that we need to have, but most likely it will be the last one to be open.
What about
right now? What we try to do is push people. It's safe to go to a restaurant. We were really. I would tell you the next PAC meeting on Thursday, we'd probably go to a restaurant somewhere and have a meeting.
Wow, that'd be a good look for you guys. Doc, what about the movie theaters?
That's something will be next. I miss my nacho in the movie, so I think.
Oh, I didn't know you ate nachos. So they're healthy. Nachos are healthy, guys.
But I think that it's something that we will talk about openly, and we can social distance in the in the movie theater,
right.
And I don't see any problem with that.
Right.
So you can even wear a mask when you watch movies, but I bring up and see what the story. We kind of put that in the back burner,
right.
But
yeah,
I think something that can open again. But it's a very step forward. We talk about tourism. We have a business meeting with the business people today on Friday. Every Friday we do, but we're going to see if we can stimulate the local tourism first. We need to. In the past, where the first thing hit here, we basically asked people to stay home to kind of start the virus. And now that we are doing very well, I think that we should at first, promote the local tourism. So that way, if everything goes well, the tourists from the other country will look at us and say, hey, they're going back to their normal life right now, so it's safe to go to Guam.
Right.
So we're going to try to see if we can stimulate some local tourism and promote to go to a restaurant and all that kind of stuff, so people can enjoy. That's the thought of going out to the meeting in the restaurant somewhere.
Right. Okay, Doc. Well,
Okay,
thank you for keeping us posted, and we'll catch up with you again next week. What are your plans for the weekend? Are you taking the boat out?
Going fishing.
All right.
Weather permits, but you guys, please ask people, still social distance and wear the mask on. And if they go out on the beach or something like that, they don't have to wear a mask. Open air is still safe, but in the closed environment, just make sure your mask is on.
Got it, Doc. Thank you.
Okay, have a good day, guys.
You too, Doc.
Take
Have a
care.
good weekend. Wash your hands.
Okay, bye-bye.
Okay, bye.
Bye.
All right. I like Dr. Nguyen. Dr. Hoa Nguyen, of course, of the Physicians Advisory Group. They advise the governor on medical issues relative to the pandemic. And, anytime they want to do something like reopen whatever, these guys are the ones who really go into it and look at the plans that, different groups like the daycares. I just was talking with our friend Lonnie from Giving Tree yesterday. She said, hey, what have you heard about the daycares? And so, we just heard that, maybe reopening soon, very soon. I think that's good because, we're trying to reopen the economy. Somebody got to watch these kids out here. 7:41. Hey, Bree, can we take a short break and we'll come back with Lacia Casil. We'll talk about there's some Pride Month stuff going on. There's also a solidarity wave with Black Lives Matter with the LGBTQ community. So we'll talk about that coming up. We'll take a really quick break at 7:41. Again, it's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Subway restaurants.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.